Listening to Our Daily Show with CJ Naselli on RiverBender.com. Our coverage continues of OSF Healthcare St. Anthony's 100-year anniversary open house, and we're here on this Thursday. We're broadcasting on a Monday so we can all watch it and have some fun. We got Jackie, we got Melissa in, and we got the Med Group. And this is really, I guess, one of the most used services within OSF Healthcare. Where should we start when we talk about Med Group overall?
Well, I think primary care is your first step to getting in the door and getting established with a primary care provider for your yearly, health screenings or, some of the younger ones need physical exams. And then if you require any type of specialty services, the primary cares are able to refer you on.
Well, it seems like you all have a really good team of primary care providers and really just a great network to work in with OSF, especially with all the additions. I'm sure it makes it to where it's so much easier to be a primary care patient within the group.
Yes, that's true. We work really well together to make the service line real easy. It streams across all of our specialties and primary care. We kind of follow the same process, so it goes
super cool. Well, let's take me through your roles a little bit. Jackie, let's start with you. Take me through your day to day.
Well,
is it ever the same?
There are some things that are the same, but there are different challenges that we run into every day. There's a lot of celebrations we get to do as well. A typical day, we see anywhere from 100 to 180 patients
really
come through our clinic.
Wow.
Some of them are there for just their, regular follow-up visits. Some of them are establishing care. Some of them are coming in for lab work, or we also have a nurse clinic that is very nice, and our patients are able to get in with the nurses to do like blood pressure checks, or if they have maybe some warfarin that they're needing monitored. We have our anti-coag clinic as well. So we start our day just opening up the doors, welcoming in our patients. We get them checked in, and I just kind of help and try to remove those barriers for our patients, for our mission partners, and for our providers so they can focus on patients.
How long have you been at OSF?
I am going on my 6th year.
6th. That's incredible. And, Melissa, how long have you been over
10
here?
10 years.
10. Well, and now take me through the specialty side of things in your day-to-day as well.
Yeah, so we have 10 different specialties and over 2 different floors, and with lots of different agreements. So we have some partnerships with SLU, with Urology of St. Louis, so we're able to bring those specialties to us, to our community here.
What's that mean, just for the folks that maybe are, kind of like me and aren't real into the medical, lingo of things? What does that mean just comprehensively for all of us?
That means that we try to provide as many of the services as we can here locally.
So we don't have to drive the 270 war zone.
That's right.
And there's been a lot of additions along the way, especially in your 10 years with bringing those in. Do you care to name a few, or just remember some that have those partnerships that have happened along the way that you've been a part of and seen the merger?
Like I said, we have Urology of St. Louis, and we have doctors that come over from SLU. And
is that the SSM partnership there?
SSM
okay.
SLU, yeah.
Really cool. Well, and today, take me through just the open house. What have been the highlights for you two, and just being out and not in the office for a few hours?
I think what's been nice is meeting the people who are coming through, and seeing how many of those people don't have a primary care provider, a doctor. Some of them have told us, no, I don't have one, but I really need to. I need to find one local. One lady told us that she was coming from Springfield area, but going to St. Louis for her primary.
Wow.
So we have those services here, and she says, I didn't even know you was here. So.
It's incredible. Well, and when you hear that, though, and so many times, and we've had it with psych services and talking about, folks going through mental health battles and, other community organizations that a lot of folks just don't have a primary care provider. And now, this is a simple question, and someone at home is going to go, really, that's the one you decided to ask today, CJ, but what's the first step to really finding a primary care provider? How long does it take normally just to start that process?
Well, I mean, that all depends where you're going. Currently, for us, for primary care, we have several new providers who have started in our practice. So our access is open. We can probably get new patients in within the week.
Really?
You may run into some areas where, you're looking for a primary care provider. It could take months to get in. It's just going to depend on the access. But for OSF right now, we're able to get you in usually within the week.
That's really cool. Well, and now, with OSF growing their services, like you said, and having those partnerships, has the efficiency of the office been able to improve because of having that all under one roof and under one, access point, truly?
Yeah, I think so. I think just being able to know where our patients are going to get certain services done. So when they do need that higher level of care, we have contacts at, let's say, SSM and SLU that we can reach out to and say, hey, we're sending you this patient. And then they make sure they come back to us so they can continue their care here.
Well, and see, that's what really matters is that true wraparound approach. So you aren't just saying, see you here in a few. You're able to really follow up and really able to help them on their medical journey, and that's so important. Before I let you go, what is the most utilized specialty? Is that, I know that's probably a tough question. Is there one that's more frequent than others?
I can tell you right now, our neurology office is very busy. There's not a lot of neurologists around, but we have added another nurse practitioner to help our neurologist out and help lighten his load.
It's incredible.
Yep.
Well, and then Jackie, before I let you go, what is the most important bit of information that someone could have, when they're making that choice on a primary care provider, or just when they're calling the office and trying to get everything, going on their medical journey? What's the best bit of advice you can give?
Sure. I mean, you want to find someone that you're comfortable with. So sometimes, it's best to make an appointment to meet that provider and make sure that, you're compatible. But always want to make sure you have your insurance information. They're going to ask you, some pre-visit planning questions. You'll get a call about that. Just your medication list, your medical history, any pertinent information around your health care. That would be beneficial.
Well, seriously, thank you both so much for stopping by, and it's really great to get some more insights on the med group and then the specialty services too, because they are important, the most important part for all of us to get our journey started, or just to make sure that we're doing everything that our primary care provider told us that we needed to do or probably should be doing.
Right.
Thanks for stopping by. We'll take a quick break. More coverage of this 100th year anniversary open house comes your way next.